So, yesterday we studied mainly about the shape, color, blood supply, nerve supply and refractive index of the lens, and also the attachments of the lens. Mainly these are the attachments, okay. We studied about the Klapkots canal, Burger's space, Weygot's ligament, like that. So, I will revise it. What are the main attachments to the lens? First one is the ligament posteriorly, which is the Weygot's ligament. Then there is a space which is the Burger's space, which is also called the retrolendal space. Then third, the Klapkots canal. This one is the Klapkots canal. This is a potential space where the hyaloid artery lies, okay. And what is the specialty of this hyaloid artery means? This hyaloid artery and this Klapkots canal, or this will disappear at the 8th month of gestation, okay. So mainly this hyaloid artery which helps in the development of the lens during the embryonic period, okay. That's it. And sometimes the hyaloid arteries remnants will be present even after the birth, and which can be called as, if it is present at the anterior segment, it is called as the Mittendorf dots, and if it is present at the posterior, that is at the optic disc, then we can call it as the what? Burgmeister's papillae. That's it. Next is about the appendages. What are the appendages which is seen in the lens? Okay, so this one is the lens, and here we draw the iris, and between the iris and lens we can see some of the zonules. Mainly 3 zonules are present. First one, the green color, which is the pre-equatorial zonules, and the pink one, which is known as this is the post-equatorial zonules, and the third one, which is known as the hyaloid zonule, okay. So these are the 3 zonules present, and between the 3 zonules we can see 2 potential space, that is between the pre-equatorial zonule and post-equatorial zonule. The space which can be seen is the canal of Hanover, okay. And between the post-equatorial zonule and hyaloid zonule, the space we can call as the canal of Petit, okay. So these are the appendages. Next we can come to the part of the lens. So this is I drawn a picture of the lens. We are going to study about the parts of the lens, okay. So first we know that this is the anterior convex, posterior convex. We can see the posterior convex is some more converging than the anterior. And the first thing, that is, we can come from outer to inner. If you are coming from outer, this outer one, which is known as this blue thing, which is known as the capsule. And while we are seeing the capsule is seen like round, like this is the capsule. And here, while we are seeing the thickness of the capsule, it is not constant, it is variable. Here it is somewhat thinner, but here it is somewhat thicker, okay. So that's the difference. So while we are discussing the thickness, the capsule is more thin, that is thinnest. So it is more thin at this side, which is known as the posterior pole. So this is the anterior, this is the posterior side. So at the posterior pole, it is the more thinnest, the capsule is, which is about like 4 micrometer only, okay. And at the equator pole, this one is equator, here the equator side, it is more thicker, okay. So here we call the site as the posterior pre-equatorial zone, because it is posterior to the equator. So that is the posterior pre-equatorial zone, where it is 23 micrometer, okay, thickness. And here, which is at the anterior pre-equatorial zone, it is 21 micrometer. So more thinnest at the posterior pole and more thickest at the posterior pre-equatorial zone, and at the equator it is like 17 micrometer. So that's all about the capsule of the lens, which is the outer protective part of the lens. And this capsule means what? It is the basement membrane. It is a basement membrane, and this capsule is mainly made up of the type 4 collagen, okay. That's it. And we can see the epithelial cells. We can see the epithelial cells, and we can see this epithelial cells that is not circumferential, okay. It cannot be seen over the posterior side. It is only seen anteriorly, okay. And at the poles, these epithelials are different. Some are not like at this anterior side. So mainly 2 types of epithelium is there. So the anterior epithelium is of 2 types. First is A cells, which are seen as a linearly, as a linear segment. We can see the A cells, that is the first epithelial cells which are metabolically active, and second one is the E cells which are seen mainly at the equator pole here. These are known as the E cells, and these are some more not like this. These are somewhat elongated. So these are columnar actively dividing cells. Okay, that's it about the epithelial cells. And second one, here the space, here this is known as the cortex, and the cortex means it is the major part of the lens, which are made up of the lens fibers mainly. And next we are discussing about the fibers. There are two types of fibers are like primary fibers and secondary fibers. Primary fibers means the fibers which are formed during the embryonic period, and secondary fibers are the fibers which are forming newly, like now also it is forming. That is it. So the second thing, so we discussed about the capsule, then epithelial cells, then cortex. Now this one, that is the nucleus, the center which is the nucleus, and the nucleus is divided into another 4 segments, like first segment 2, 3, 4, like. Why it is divided into 4 means, the first one, that is this one, this part of the nucleus is formed during the embryonic period, which is the embryonic nucleus. And second, when the fetus, when we become the fetus, first we are embryo, then second stage when the embryo gets attached or implanted, we call it as fetus, and when the baby is born, we call it as infant. Okay, after that we will become adult. So each of the stage the nucleus is formed, and we call that nucleus as embryo nucleus. If it is formed during the fetal stage, we call it as fetal nucleus. Then if it is formed during infant stage, then it is infant nucleus and adult nucleus. That's why it is embryo nucleus, fetal nucleus, infant nucleus and adult nucleus, 3. So this is the nucleus of the lens. Okay. And another thing about the epithelium, that is we talk about the anterior epithelium, then you will be having a doubt about where is the posterior epithelium, why it is absent here. The posterior epithelium was there during the embryonic period, and it disappeared at birth. Okay, that's it. So where it goes, this posterior epithelium is absent. Okay, because this posterior epithelium that gets formed the primary lens fibers during the embryogenesis. So nucleus, we studied this, that is 4 zones: embryonic, fetal, infant, adult. Here the embryonic nucleus is the what is the function of the nucleus means, these will forms the fibers of the lens. So the primary fibers, that is during the embryonic period, the fibers are formed by the embryonic nucleus. These are the, so we call that primary fibers as the oldest lens fibers, and other fetal, infantile and adult nucleus forms the secondary fibers. So these are formed, now also it is formed by the adult nucleus, then we call it as the youngest fibers. Okay, next is the sutures in lens. So while we are talking about the sutures, you will be thinking like, sutures, what is sutures? It's not about like what do you think the sutures. Here the sutures are like joints or interdigitations between the fibers. Okay, so we know that first the fetal nucleus will be formed, and around it the infantile nucleus will be forming. So in between them some interdigitations will occur. Okay, so these are the sutures in lens. So the next is the proteins in lens. Okay, so proteins in lens are 2 types: water soluble proteins and water insoluble proteins. The water soluble proteins are called as crystallines. Majority of the proteins in the lens are water soluble, so we call our lenses sometimes crystalline lens. Okay, and the second one is the water insoluble lens, that is the urea soluble and urea insoluble. Again it is divided. The urea soluble proteins are vimentin and filin skin. Okay, they are also called the cytoskeletal proteins, which forms the structure, which helps in the structural formation of the lens. Then urea insoluble proteins, which is the first one is the MIP26, which is the major intrinsic peptide, or aquaporin 0. So aqua means we know it is related to water. So it is mainly helps in maintaining the transparency of the lens, which will helps in keeping the lens dehydrated without forming any edema in the lens. Okay, and the water soluble proteins, which are again are of 3 types: alpha, beta and gamma. Here the alpha, which is heat shock, are also called heat shock proteins because it helps in preventing the degeneration of other proteins. Okay, and the majority proteins which is beta. This some like PG point, that is some other proteins are present like HMV proteins, high molecular weight proteins, so HMW proteins, which is HM1, HM2. These two are water soluble, and HM3 and HM4, these are water insoluble proteins. What is the significance of these proteins means the concentration of these proteins will be increased in the catractans lens. Okay. Next, the antioxidant mechanism in lens. So what are the vitamins which helps in antioxidation? Mainly vitamin A, C, D, A, C, E, but here we will not say vitamin A because here vitamin A does not act as antioxidant in lens. But overall it helps in antioxidation, but in lens the vitamin A will not help in antioxidation. Mainly vitamin C and E will be helping in antioxidation. Others are superoxide dismutase, SOD, catalase, then glutathione reductase, then vitreous. We know that in lens, posteriorly we can see the vitreous and anteriorly we can see the vitreous and aqueous. So here the vitreous humor will be helping in maintaining low oxygen level around the lens. So it is also an antioxidant. Okay. Then next point is how cataract formation occurs. So the doctor will be saying to the cataract patients that you please eat these things. So that is based on the tryptophan. So those who have the tryptophan deficiency, this will lead to the decreased levels of antioxidants except the superoxide dismutase. So this tryptophan will lead to the decreased level of antioxidants except the SOD. So if the antioxidant gets decreased, this will increase the incidence of cataract formation. So that's it. Next is another one thing is also there about the metabolism which is taken place in lens. We all know that just like of other organs, the lens also need glucose, and we know that the glucose, it is an avascular organ, and also around the lens also there is no oxygen or anything supplying to the lens. Therefore from where the glucose comes to lens need glucose. So the glucose is coming from the anteriorly from the aqueous and vitreous, and posteriorly from the vitreous. Okay, 90% glucose comes from the aqueous humor, 10% from the vitreous humor, through which process? Through simple and facilitated diffusion. And after the glucose comes to the lens, it gets metabolized. Okay, so we know that the lens is avascular and no oxygen. So therefore the metabolization is mainly occurs by anaerobic mechanism, that is the glycolysis, greater than 80%. And approximately 15% of the metabolism is either by the Krebs cycle or by the hexose monophosphate shunt. Okay, then less than 5% is by the sorbitol pathway. Even if it is less than 5% also, it is very important, the sorbitol pathway. How we can discuss the sorbitol pathway here. First, the glucose will be converted to sorbitol, and then it will be freely converted to fructose. Here it is converted to sorbitol by the aldose reductase. Okay, this sorbitol and this fructose. So here the glucose is converted to two different compound sugars only, sorbitol and fructose. So what is the importance of this sorbitol pathway means, when a patient is hyperglycemic, when a patient becomes hyperglycemic during diabetes mellitus, or during if the patient has galactosemia in children and infants. So during this condition the person will be hyperglycemia. So in this condition, due to the feedback inhibition to the glycogen, there will be inhibition of the glycolysis cycle, and at this time the sorbitol pathway gets activated. Okay, and what happens when the when the sorbitol pathway gets activated, there will be sorbitol and fructose will be formed. And what is the peculiarity of this sorbitol and fructose means, we know that the glucose can easily pass from the lens to the aqueous and vitreous through the simple and facilitated diffusion, but the sorbitol and fructose cannot diffuse out of the lens. Therefore this will accumulate in the lens, and this will lead to the increased level of sugar in lens, and this will increase the osmotic pressure in the lens. Okay, so for equalizing the osmotic pressure, what will happen means the fluid from the aqueous and vitreous humor will enter into the lens, and this lens becomes hazy and opaque, and this condition which is known as the cataract. So that's important of the sorbitol pathway. So mainly the cataract happens in a patient who is hyperglycemia, that is diabetes. Okay, that's it.